From bench to bedside, translating research into health policy with implementation science. Welcome to my channel. In today's video, we're discussing how scientific discoveries make their way from the research lab to real-world healthcare settings and even influence health policies, all with the help of implementation science. Whether you're in healthcare, policy making, or research, understanding how we translate research into practice is key to improving health outcomes on a large scale. Stay with us as we explore how implementation science makes this possible. It's one thing to discover new treatments or interventions in a lab, but it's a completely different challenge to ensure that these discoveries are adopted in hospitals, clinics, and health systems. Implementation science helps bridge this gap, guiding the journey from bench to bedside and beyond to influence health policy. Let's break down what we mean by bench to bedside. This phrase refers to the process of taking scientific discoveries from basic research, or the bench, and applying them in clinical settings, or at the bedside, where patients receive care. Here's how the process typically works. Researchers conduct studies that identify effective treatments or interventions. Then, implementation scientists work on translating these findings into real-world practice by developing strategies to integrate them into healthcare settings. This process doesn't stop at the bedside. Ultimately, the goal is to inform broader health policy to ensure that effective interventions are adopted at the national or even global level. One powerful example of this journey is the translation of cancer research into clinical practice and policy. For instance, years of research have led to the development of new cancer treatments like immunotherapy. But how do these cutting-edge treatments reach patients in everyday healthcare settings? Implementation science plays a crucial role in adapting these treatments for widespread use. This involves everything from training healthcare providers to ensuring that health systems have the resources and infrastructure to deliver the new therapies. On a policy level, implementation research also informs decisions about how these treatments should be covered by insurance or integrated into national cancer treatment guidelines, making sure that they benefit as many patients as possible. Another example is how public health research informs health policy on a large scale. Take tobacco control, for instance. Decades of research have shown the harmful effects of smoking, but it took strategic implementation to translate that research into effective public health policies. Through implementation science, research findings were used to shape policies like smoking bans in public places, warning labels on cigarette packs, and increased tobacco taxes. These policies, based on solid evidence, have dramatically reduced smoking rates and improved public health outcomes. This is a clear example of how translating research into policy through implementation science can lead to broad, population-level impacts. Successful implementation of research into practice and policy doesn't happen in a vacuum. It requires collaboration between various stakeholders, including researchers, healthcare providers, policymakers, and community members. Engaging stakeholders early and often ensures that interventions are relevant, feasible, and likely to be adopted. This collaborative approach also helps ensure that health policies are grounded in real-world evidence and are more likely to be implemented effectively. So, what can we learn from these examples? Here are some key takeaways for successfully translating research into health policy. 1. Engage stakeholders. Early involvement of all stakeholders, from the community to policymakers, increases the chances of successful implementation. 2. Be adaptable. Tailoring interventions to fit the specific context of healthcare settings ensures that they are more likely to be adopted and sustained. 3. Focus on evidence-based policy. Use solid research as the foundation for policies and ensure that there is ongoing evaluation to refine and improve these policies over time. By following these principles, you can help ensure that the research you conduct or support makes a real-world impact, not just at the bedside, but in shaping health policies that improve outcomes on a larger scale. Implementation science is key to making sure that scientific discoveries don't just stay in the lab but reach patients and influence health policies that shape the future of healthcare. If you found this video informative, make sure to like, subscribe, and share it with others who might benefit from these insights. Let us know in the comments how you see implementation science playing a role in your field and what topics you'd like to see us cover next. Thanks for watching, and we'll see you in the next video.